you should be doing total quality management because it's the right thing for you as a leader, it's the right thing for your organization, and it's the right thing for your employees and customers.
You need to go out and learn what TQM is. Know what it is and be willing to walk the talk, if you will, and practice it.
I think the change that we made in Fulton the last 3 years has been very significant. Something's happening here that is very, very powerful.
One of our interests here at the Institute is the changing nature of quality in behavioral health care. For example, the dome building you see behind me at the St. Louis State Hospital was built in 1869, 4 years after the Civil War. At that time, our idea of quality was to give people a place of refuge or asylum from the stresses of everyday life. Today, of course, we seek community integration and a system of supports to help people return home as soon as possible and remain there. In this film, we'll be looking at some other new ideas about quality in behavioral health care and how one pioneering psychiatric hospital has been applying them. Actually, these new ideas about quality are not so new at all. Having been introduced by W. Edwards Deming in Japan after World War II, rediscovered by U.S. corporations in the 80s, applied to healthcare in the 90s, and now to behavioral health care in the last few years. These ideas have been called by many names, including total quality management, or TQM, and continuous quality improvement, or CQI, among others. By whatever name, they collectively refer to a leadership philosophy that helps organizations do a better job for their customers through the use of quality tools and the involvement of everyone. Now, by customers, we mean anyone who benefits from our work. This includes external customers, such as our clients and their families, as well as internal customers or our employees. Behavioral health care and other organizations that practice TQM share several important characteristics: committed leadership, a culture that supports quality ideas and change, training for all employees, a philosophy of continuous improvement, teamwork and the use of quality tools, a customer focus, and the involvement of everyone. To help illustrate these ideas, let's take a look at how one behavioral health care organization is applying TQM and some of the dramatic results it is achieving. We start our journey here at the Fulton State Hospital, located in mid-Missouri, just a few miles north of the state capital in Jefferson City. Fulton is the oldest public psychiatric hospital west of the Mississippi, having admitted its first patient in 1851. Today, the facility has 500 beds, both acute and long-term, and its 1,250 employees treat people with a variety of psychiatric conditions. The campus also includes a large maximum security forensic unit. Fulton State Hospital began its TQM journey in 1991 under the direction and leadership of Superintendent Steve Reeves.
We've been moving down the road on our journey in TQM for about 5 years now, 4.5 to 5 years. And it really began in 1991 when I made a decision, or when I perhaps realized that I needed to make some changes not only in the way I dealt with issues here, but also the way that this hospital overall dealt with issues. I needed to look at what my decisions, what kind of impact on the employees and the clients my decision-making had.
We got into TQM at Fulton here as a result of our superintendent. Reading about it, becoming interested in it. He's been interested in it for a number of years, actually, before we started here. He was, I guess, lucky enough to hire a new quality assurance director, which was me, when he got started with this. And he gave me a book, and he said, read this, and he said, we're going to do this. And he said, you're going to be very involved. And so I read the book, and I came back and I said, okay, I've read it, now what? And he said, we're going to do TQM here at Fulton State Hospital, and your office is going to lead the way.
So our first step was to get our upper-level management people not only trained in the concepts of TQM, but also to believe in them. The training was easy. I mean, they got that in a couple of days. The belief, I think, took a little longer. Many of the upper-level employees, upper-level executive staff here were long-term employees, 25, 30-year employees, and they'd seen fads come and go. Quality circles and other types of fads, management by objectives. They seen them come and go. I think the one thing they didn't understand is that this wasn't a fad, that this was a lifestyle. That it's not something that you can, again, just put in place, but you have to live on a day-to-day basis.
An important aspect of many organizations' quality journey is the development of a mission, vision, and set of values to help guide it toward its destination. This was a very important aspect of Fulton's TQM journey.
The development of a mission and vision and a set of values for this organization has been very important to us. And of course, the reason that we did it is for us to set a direction, a beacon, a guiding light out there for us to move towards. We have a very specific mission within this hospital and this organization to treat the clients and serve them and care for them in certain specific ways, and to our employees for them to know that we're going a certain direction. So we started out, a little over a year ago actually, and I pulled together 30 individuals from across the hospital. They had been trained in TQM, trained as facilitators, and I said, here's what I want to do, guys. I want to develop a vision, a mission, a set of values. I said, we're going to set together as a group. We're going to develop what we think our mission and vision is, and then we're going to go out to the field and we're going to find out what everyone else thinks. Through that process, we met with over 600 people and got feedback and input from those 600 people about what our vision should be, what our mission should be, and a set of values that we were going to use to live by. And the process worked very well. It took quite a while to get that feedback, to analyze it, talk about it, and finally get the language in place. But I think what we ended up with in terms of a mission and a vision statement and the values that we live by are very, very good. And they now, of course, provide us with the guide for us to decide what we're going to do, how we're going to spend our money, and where we're going to go in the future. And most importantly, the set of values really establishes how we treat each other, not only as employees, but also how we treat our clients and our customers. And I think those are probably as important as anything we have.
One issue facing leadership is that of the organizational culture or patterns of behavior within the organization. If the culture does not support a TQM effort, then it is difficult to maintain.
I don't think there's any question that the organizational culture impacts dramatically on the ability to apply total quality management. But I think there's two issues involved with that. I mean, it's not only the organizational culture, but it's also the leadership culture. I think the leadership has to make sure that their style of management and TQM fit hand in hand. A leader cannot go out and just say, we're going to do this total quality management thing. We can't just go out and say we're going to do that and expect it to happen overnight or expect somebody else to put it in place for you, because that's not going to work. The leader has to sit back and say, this is something I believe in, this is something I will live, and then start making the culture or working with the culture to understand and trust that what leadership is doing is in their best interest, and that they will then get some participation, some decision-making power, some empowerment to do things that they've never gotten to do before. So the culture is very important, but so is the leadership. They've got to work together hand in hand.
There are a lot of changes between the old way of quality assurance and the new way of TQM. One of the major differences is quality assurance focused on pointing fingers, particularly pointing fingers at people. If there was a problem at a facility, then it must be due to some person or group of people doing it wrong. With TQM takes a look at the process and says, what can we do with this process to make it easier for people to do their jobs? Another wonderful thing about TQM is they go to the people who actually do the job with the teams and say, how can we do this better? How can we make this process better? The assumption is people are here to do a good job, and that's a major difference in the old way from the new way.
Training for all employees is key to a successful TQM effort, and the experience at Fulton has been no different.
We had to move on, of course, into getting training done for our staff here, and that's been going on for over 2 years. And right now we've probably got 85% of this hospital staff trained, and that's 1,250 employees total, so we've come a long way. And then we found, of course, that as usual, what happens is you have your upper level people trained and you get your frontline staff trained, and then your middle managers are caught right where they're supposed to be, and that's in the middle. And they're not sure what their role changes are or what's going to happen to their positions or how they're supposed to coach and mentor. So we're working on that right now with some specialized training for our mid-level managers.
Training is really key in implementing TQM in a facility. I think it becomes even more important when your facility has 1,200 employees. Beyond basic TQM, we offer a team leader facilitator training, which is a 2-day course in which people are given the skills to be able to be a team leader or a facilitator for a team. Things like flow charting, cause-effect diagrams, a little bit about group process is all taught within those 2 days. Then once a person becomes a team leader or a facilitator and goes out into the big bad world and actually does something, we offer what we call advanced team leader facilitator classes, in which they come back and work on those skills again, or practice them, or get their questions answered, particularly about the tools that they're using. We also have included things on survey writing, because a lot of our teams do surveys. So we're offering advanced classes to give them a few more skills. Celebration is important here at Fulton State Hospital. One of the things we do is after a class graduates from team leader facilitator, we have a graduation ceremony. The superintendent dresses up in a tux and comes over and gives an inspirational speech, and we usually have food, and we try to recognize people for the accomplishments that they have made. We also try to combine that then with a discussion from people who are living the life of TQM. What's good, what's not so good, what can we do, particularly as administration, to change and give them more skills or tools or support or whatever it is. So we actually combine the two, and it's been very effective for us.
About 2 years ago, a committee was formed, a CQI committee was formed, and it's called the Shorter Staff Squad. And the purpose of the committee was to look at holdovers in the whole hospital. And it wasn't too far into that process that we realized that in adult services, we had some very specialized problems. First of all, we had the highest rate of holdovers. We had the highest comp time hours also related to the holdovers. We also realized that some of the procedures we were using was not consistent between the different shifts. So it was really very confusing. And what that led to, besides a high cost, what it also led to is very low staff morale. And grievances often came and related to the holdovers because we weren't being consistent. So within the unit, we developed our own CQI team, and we called that the Solutions to Overtime Personnel, the STOP Committee. And we've met for a year now, and with the same goal. One is to reduce comp time hours, to create a system and a process that would be consistent among all 3 shifts, and also to improve staff morale.
I suppose probably one of the most significant processes that we've spent time looking at in the past couple of years has been medication errors. In a mental health facility and in a physical health facility, the giving of medication, the taking of medication, the side effects that are possible is a major process that we undergo here. With medication errors here, we already knew that our error rate was very low, but some of the errors that were being made were of concern to the medical staff, and they wanted to take a closer look at it. they thought that they had data or they had assumptions about what they thought was happening, but they wanted to collect data to make sure that they knew what was happening before they took action. That team actually went on for almost a year. Indeed, the medical staff had their finger on the pulse, if you will, as to what the problem was, but they now had data to back that up and have been taking action, and our error rate, even though it was already quite low, has gone down.
The benefits are great. Increased employee morale is a tremendous piece of that factor, in the public sector especially, where salaries are fixed and jobs are protected. There's little motivation in a lot of cases to do anything other than for a leader to sit at the top and direct what's going to happen. That usually creates low morale and low productivity. What I have seen, and again, this isn't through any studies by any means, but what I have seen is that as we have been able to allow participation by the employees, as we have been able to get them in, or give them input into processes and decision making, that their morale has increased.
One of the things I think TQM has done, and I'm very much a supporter of the process, that it does truly empower different levels. It was very uncommon, I would say, in the years past for decisions to come down and made by people that I thought had very little understanding of the real problems on the unit level and even on the ward level. And I think something that I have learned, and I try to incorporate this in my own skills as a manager, is to get people that know the most about the problem to help resolve and solve the problem. Because in any resolution, you do two things. One, you really got to know what the problem is. And the second thing you got to find out is that they have an investment. And they have investment to make sure it is successful.
I think the department's a little stronger. The cohesiveness of the aid staff is much greater. The aides that are participating are feeling much better about themselves, about the job they do, and they're feeling a part of the whole organization instead of all decisions coming from top down. Now some are going from bottom up.
That increased morale improves the work environment. And the work environment being improved creates that circle. If the employees feel like their work environment is improved, they're happier in the work they provide. And if the employee is a happy worker, they're going to provide good client care, good patient care for those clients that they are providing care to. And I think, to me, that is probably the one intangible, or the most important intangible thing that we can get out of this whole process, is that just by improving morale, we can improve the care we give to the client.
First of all, you have to make sure that if you are not the head of the facility, that the head of the facility is totally committed to getting into TQM. It's vital. Without that, I don't think you can be successful. So you have to have upper management support. The second thing is you need to go out and learn what TQM is. Know what it is and be willing to walk the talk, if you will, and practice it. And I do think that takes some education on the part of whoever is going to be leading the way, if you will. The third thing is to persevere, because in our journey, which has lasted several years, there have been points of frustration for myself and for the superintendent in which we think, what are we doing here? Why aren't people getting on this bandwagon? Well, we are. Why aren't, this is good stuff. And what happens is you hit plateaus in which a certain group of people have joined you, they feel good about it, but then you get to the next level of person or people or staff, and they're a little tougher to bring on board and to give them the skills and to convince them that this is the way we want to do business here. So hang in there would be the third thing I would advise them.
I don't know if it's just this culture or any culture that you're trying to change, but I don't think it's something that you're going to do in a very short period of time. We've been working on this cultural change, as I said, since 1991. Just in the very last month, have I received something that has made me feel that the last 4 to 5 years have been worthwhile to a certain extent. A lot of what you go through during this time period is a lot of frustration, wondering if what you're doing does make a difference. And I received a letter from a frontline employee who received training, who's been a member of a team, who's also gotten actually trained as a facilitator for our facility. And let me just read this real quick, because I think it was my first indication, I guess, that what we're doing is having an impact. I'm just going to excerpt this one piece. It says, "I can see the difference you are making, and others are noticing it also. I know from personal experience that positive feedback is rare at times, so I wanted you to know that the job you are doing is really top rate, and you should be proud of what you have accomplished. I know it's a long, slow process, but the future looks better. This is really good for the overall picture." That is the first indication that what we've been working on for the last 4.5 to 5 years is having an impact. And this has probably made everything we've done to this point, just this one letter, worthwhile.
Some people have said that TQM is dead. I think it's just beginning to be appreciated by behavioral health care organizations as a very powerful tool for helping us improve the quality of services for our clients and the quality of work life for our employees. We have come to terms with the limitations of the asylum concept. Now, if we want to remain effective into the 21st century, we must learn new ways of managing quality. Remember, as stewards of our craft, we owe our customers the best we can give them. Besides, just look around. The world needs us now more than ever before.